Hello, I'm here with Paul Frick, University Distinguished Professor and Chair of the Department of Psychology from the University of New Orleans. Dr. Frick is an expert in evidence-based assessment for child and adolescent mental health problems. So today we're going to be talking a little bit about how parents can find a little bit more out about youth mental health assessment. So, Dr. Frick, one of the first questions I think that a lot of parents would want to know is if they're concerned about their child's feelings or problems, behavior problems, who can help them figure out whether it's actually a mental health problem?
Yeah, there are actually two stages to that question. One stage that parents often is it something that I even should be concerned about and get an evaluation? And there, most often the person who parents go to, and actually they tend to be very good at helping parents determine whether they should take the next step, are primary care physicians like a pediatrician or a family physician. They're often in a good position to know, should the child get more testing and get an evaluation for mental health problems. Then once, the parents decide, and usually with the help of a physician, that they should, typically, the people who are in best position to do testing are psychologists. Now, I want to make it clear, I am a psychologist, so maybe there's a bias there, but it's one of the things in the training of mental health professionals that is usually more emphasized for psychologists than for other professionals. And so, the second thing is I recommend a psychologist. The third issue is, usually getting some recommendations about psychologists who sort of specialize in testing, because some psychologists, even though they were trained, really don't do it a lot and don't get specialized training. Now, if a parent is having trouble finding out who's good in a community, one thing I recommend is typically calling a university and talking to either the university clinic, because there, oftentimes professors who are in the university have connections in the community. And if they can't offer the services at the university, they typically know who would do a good evidence-based assessment in the community.